Getting a little more technical here. This is from Dr. Daniel Approx, and the book is indeed Hypnosis and Sex Therapy. There's 3 ways that he used it in sex therapy, and we can adapt this, of course, to clinical sexology or to a hypnosis practice. We're going to look at the genesis of the problem. We're going to look at sort of the symptoms, what happens, does the erection go away, does the person freeze, what goes on. And you can also use it for mental rehearsal, where you have the client imagining themselves in as full a multi-sensual way as possible under hypnosis, and having the kind of satisfying sex that that particular person wants. And of course, I don't have to tell this to the clinical sexologist, but for anybody else in this room, you do not want to determine for that person how you think they should be having sex. No, no, no. They get to decide, if it's going to be whatever, you let them run with it. This is their eros, and you want them to be authentic with it. So if they're married, you cannot insist that their fantasy figure in the scenario is going to be their spouse. It may be somebody else. That's just one simple example. So be very careful with that. Just, a caution. I want to say, too, about the Plicit model, which is the model developed by Jack Annan for sex therapy and also for clinical sexology, that it works well within the Plicit model. We're working with it in a different level. The permission in this case is given to and by the subconscious and intuitive part of the self to address the problem and to talk about the sexual issues. And you do talk under hypnosis. You can have a whole conversation with somebody. Sometimes you have to be a little careful, because for some people talking brings them up a little more, and they may jump back into their everyday mind. So a lot of times when I'm first working with somebody, I use finger signals for response until I get a sense of how they are under hypnosis with conversation. And hypnosis, I want to say, is a learned skill. So permission, limited information, specific suggestions, and if you do not offer intensive therapy, of course you refer on, and if you do, hypnosis can also be used and is used by psychotherapists who offer that. You can Google the Plicit model. This is strange. I have repetitive titles on the slide. Oh well. I like this idea, this quote by Dr. Approx, that it's a state in which the critical mental faculties are temporarily suspended and the person uses mainly imagination or primary process thinking. This is why hypnosis is so deeply interesting and effective. And I'm going to move on again. We talked about negative self-hypnosis. And again, another quote from this man, I think he's almost my guru, if I have a guru in this life, robs the sexual experience, or even the thought of it, of playful spontaneity and contaminates it with anxiety. So this is one of the primary things we have to overcome doing work in sexual issues with hypnosis. We want to get that negative self-hypnosis, negative self-talk out of there and counteract it with powerful positive suggestions. I'm really big on this idea of authentic sexuality. This is the sexuality craved and desired and expressed by your client. I looked at, the Helen Singer Kaplan, idea of increasing pleasure in the 3 phases of desire, arousal, and orgasm. Yeah, that's great. You can use hypnosis to add variety, particularly if your client begins to get into erotic hypnosis, either doing it with themselves or with partners. If somebody's shifting their orientation or interest, they're uncovering something that they haven't wanted to recognize for a while, you can certainly support that process with hypnosis, to support the self-esteem and self-confidence and the relaxation, which will counteract anxiety that might arise, particularly if that person is moving into a recognition of something that is still socially unacceptable, or perhaps culturally unacceptable, or unacceptable within their own family context. So you want to really support that person with their positive things that you can do with hypnosis. You can help them to meet interests of partners, of new partners, or new interests of old partners, actually. And you can also use hypnosis to help accommodate disabilities or medical conditions or aging issues as well, relaxation, blood circulation, again, self-confidence, things like that. Lots that you can do. You can remove things that block the experience of authentic sexuality, and I just mentioned a number of those. Sensory integration issues is a whole other topic, and I'm just throwing the words in here. I have another course, a whole hour on this, that you can access on tape here at CreativeSexuality. Sensory integration to me is the walrus in the room of sex therapy and clinical sexology, because I say walrus because we talk about the elephant. We know the elephant's there, but nobody even knows the walrus is around. But I believe that these undiagnosed sensory integration issues can have a huge effect on our sexual behavior if we're not aware of it. And I think there's a lot of work and interesting stuff to be done in that area. Of course, partner influences can also be something that block authentic sexual expression or recognition of an authentic self. Moving right along. You can use it to assist other processes. For example, the Hartman and Fithian, who are, classic sex therapists, were, in the Masters and Johnson style tradition, actually used hypnosis with 50% of their clients to help them relax for the sensate focus exercises. This is wild. They don't really discuss it beyond this one sentence in their book, which I think is quite interesting and somewhat of an oversight. So if you study at the Institute for Advanced Study of Human Sexuality, you are given the Hartman and Fithian book to read, and you'll find, I think, in chapter 11, this little thing about hypnosis. Moving right along. Another huge area I see, and I'm going to be going very quickly through the next few slides because we're only got about 7 minutes left here. There is a huge opportunity to use hypnosis to support transgender, transsexual, and gender variant clients, and you can see here on the slide. These folks are ignored anyway by most mainstream and alternative helping professions. They're not honored and respected as much as they should and deserve to be, and there's also, living the stresses and the violence of living in a transphobic world definitely wear on them. The suicide rates are enormous, and I think that there's definitely room for compassionate, respectful assistance using hypnosis for those who want it and who might consider it. And also, as with anybody who's going for surgery or a complicated medical procedure, if you get trained in medical hypnosis, you can help with some of that healing and pain control work that can be done for anybody, whether it's a, colostomy or a chest surgery, I'm just throwing colostomies out, I don't know why, but anyway, early in the morning, need more tea. All right. Hypnotic Homeplay. This is another thing I'm very excited about, and I think that there's a wealth of opportunity here to introduce hypnosis, lighthearted hypnosis techniques to couples or clients or intimate multiples, let's not leave them out, in using hypnosis techniques as a form of erotic fun and games, and also supporting, of course, relaxation and things like that. Subliminals, I want to say subliminal tapes are controversial. Affirmations, they're nice, but I think they're better with the, the oomph of hypnotic suggestion and the trance state behind it. But there's, I think, a lot that you can do. You can become playful and happy and enjoy things with erotic hypnosis, and that sexologists, sex coaches, and possibly even sex therapists might want to consider developing programs. We have sensate focus exercises. I think we could also do, hypnotic exercises for couples, or etc. So the other idea is you can't be afraid of using erotic scenarios under hypnosis. And this is slightly problematic in some ways because organizations for hypnotists, such as the National Guild of Hypnotists, they don't want you to use sexually explicit language with your clients. On the other hand, if you are trained as a sexologist, sex coach, or sex therapist, of course you're going to have to use sexually explicit language. But you're using it, in the context of you're helping the client create an erotic scenario which is going to be helpful to them, to address the problem at hand. And this can be quite wonderful. To me, it's almost the equivalent of sexological body work in that it's very deep and very important to the client to be able to access this part of themselves. Though I also want to let you know this is a hands-off modality, but you're using words, images, and your client's imagination to create quite a profound experience for that person, and you have to know what you're doing. We talked about the Hypnotic Homeplay, and one thing that you want to do if you decide to venture into this terrain is to first work with your clients to negotiate any safety or trust issues before they start to do their first trance play together. You want to give them some basic instruction in hypnosis and have some objectives based on the presenting issues, and you have to be prepared to support them during this learning process. And the same goes for erotic self-hypnosis for any individual. There's many ways to use this. And again, I'm happy that you're going to be able to access the PDF of these slides. You'll be able to download them, so you don't have to remember everything I'm saying here. You'll also be able to watch the video. It's going to be free. It's going to stay free. And it will be in the public area of my campus so that you can watch this at any time if you want reminders. So again, you're assisting relaxation and comfort with sensate focus exercises or other things that you might suggest for your clients to do. You're assisting the emergence of authentic sexuality and eroticism, and not to mention gender identity and expression too for those clients who are coming to you for that. You can help assist remove the blocks to sexuality and intimacy, and you can help create erotic scenarios for therapeutic and enrichment purposes. And the enrichment part is the Hypnotic Homeplay assignments. And I want to make that strong pitch again. Dual training is needed for this. The hypnotists need training in sexology or sex coaching, or at least take some mainstream human sexuality courses at a college, if nothing else. I don't happen to think that's good enough, but at least it's a start. Sexologists and sex coaches need training in hypnotism if they want to use this modality. And we all need more training and protocols for working successfully with our transgender and gender variant clients. That's huge. So I have pulled together the Center for Sexological Hypnotism through CreativeSexuality. You knew there was going to be a pitch coming, right? And I'm going to offer these kinds of training because there's a need for it, and I think our clients, bottom line, are going to be better off if we can create the skillful marriage of sexology and hypnotism and have some good training and good protocols, good ethics, the whole shebang. I'm so sorry. I don't know why the repetitiveness. But if you don't get it once, you're going to get it several times here. I don't know why. Doing the PowerPoint slide and translating it over here in the Skleepo, this shows up. Anyway, glad you had a sense of humor about it. I see the lulls. And I hope you've enjoyed this presentation. I've enjoyed doing it. You're always welcome to call me at et cetera, et cetera, et cetera, et cetera, and give me a shout. And for those, there was one person who needed a certificate of having attended here. Just email me, and I'll make you one saying that you were here. And other than that, thank you very much for being here. I've enjoyed it. If you want to stick around for a few questions, I'm quite happy to be here. And I'm looking at the chat window here to see what comes up. So Okay, so email me, those who want the certificates, and I will send you a PDF, within moments. So just go ahead so that I have your email, and then I can send it back to you. And that'd be great. Happy to provide. It's only a half hour, but hey, it's something. And yay, so this is another person from the Institute. Keep in touch, okay, everybody. And thank you for being here. And I look forward to hearing from you and sending you certificates and anything else that you want. All right, thank you. And we'll say goodbye.